Happy Friday, everybody. It is Friday at 5 p.m. This is when we come together and we remember that we have what it takes, we are resilient, and we are strong, and we're going to get through this, and we're going to get through this together. It helps to say it. It helps us believe it. It helps us to know it, that we're going to get through this, and we're going to get through this together. So one last time, we're going to get through this. We're going to get through this together. We're going to get through this together because we understand the different steps that it'll take, especially being healthy at work, to make sure that we can reopen, that we can revive our economy, that we can not only create new jobs, but we can create our economy of the future if we know how to do it in the midst of this coronavirus. If we can make sure that the vast majority, if not all, of our businesses, our employees, make sure that we follow these steps, then we can do this in a way that makes sure that we surpass other states, that we come out stronger and in a stronger position than we were going in to this epidemic. I believe that's possible, and I'm committed to making it happen. Not only do we need to follow these 10 steps, but if we're truly talking about wanting to come out of this stronger, we have to fill out our census. Other states are catching up. Every state that catches up to us are fewer dollars for us to rebuild. Think about it. Every dollar that goes into our economy, every dollar of job training, every dollar that goes to health care, every dollar that helps a child that needs our help, every dollar that helps the disadvantaged, the unfortunate, every dollar that we can use to make ourselves stronger, we should want. And when the federal government is already giving out those dollars, let's take the share that we need that's based on how many people go online or call this number and go ahead and fill out the census. We're doing some of the best we've ever done on the census, but that's not enough. We've got a chance to do even better. All right, and it's not just your duty as an American to fill out the census, it's your duty to vote. We have our primary election coming up in June. There is a safe way for you to do it. Go online, request your absentee ballot with an update on that. 190,000 requests have already gone out, even just a week. I think it's a week today, and we've had 190,000 requests. Well over 200,000 requests with counties, including Jefferson and Kenton, that started the process earlier. And so let's make sure that that's 200,000 total. They think at least 35,000 have applied through the process in those areas. So please be patient with the clerks. They're working to get the ballots out, but go online, make sure you vote. It's incredibly important. Let's make sure that we get it done. All right. Waking up today through a difficult night in Louisville last night, I wanted to make sure that I started with a few remarks, and I think they're poignant after Reverend Akins from last night. First, Louisville was my home for more than 15 years before I won this office and moved my family to Frankfort. It is a special place. It's a special place to me. I know they've said in politics before that you shouldn't say that you've lived in Louisville or you loved it, but you know what? I did and I do. But it's also a city where we can see the impacts and the vestiges of slavery, of segregation, of Jim Crow, and it's almost that it occurs on a specific street. And I believe what we have seen in response to a very concerning shooting of an EMT, a young woman who worked to save lives of others here in Kentucky, is hard. But in a broader context, and we've talked about it here a number of nights, is this pandemic we're facing has laid bare the inequalities that still exist in our society and that many times are fatal. As you've seen from our charts, our Black or African American population is about 8% of our statewide population, but it's about 19% of our deaths. We've allowed that inequality to exist for hundreds of years, with many times that we could have changed it, or many times that we could have made more strides. And we see it specifically happening in Louisville. I know the family of Breonna Taylor is working hard to ensure that we don't continue to see this type of inequality and this type of violence in so many different ways that can occur. So last night's event started with a very peaceful protest, one where people wanted to be heard but didn't want to cause harm, one where people were seeking justice. And I'm going to say, having now seen a number of protests, that it was also one of the safest, one of the most compliant with CDC guidelines, that these were people truly looking out for human life. And then I believe some other folks very late, more than 3 hours in, came in and ultimately instigated actions that have been hard to see. But this morning, Breonna Taylor's mom reached out through family representatives, and this morning on CNN I read a statement from her mom, because I believe in this instance her mom's voice, which should be heard in this situation regardless, but is a really important voice for us. And I'm going to read it in full, and you're going to be able to tell from it, it's not edited. It's what she wanted to say, and it's important. Breonna devoted her life to saving other lives, to helping others, to making people smile and bringing people together. The last thing she'd want to see right now is more violence. Changes are being made, but it's not enough. We will not stop until there is truth, justice, and accountability. Breonna's legacy will not be forgotten, and it's because of all of us saying her name and demanding justice. We are saying her name more each day. Thank you. Please keep saying her name. Please keep demanding justice and accountability. But let's do it the right way, without hurting each other. We can and we will make some real change here. Now is the time. Let's make it happen, but safely. Statements from her mom, still very raw, still very emotional, but even in the place that her mom and her family are in, I think it's very important to them and to the legacy of this young woman that demonstrations are safe, and that there is not violence, but that what they're saying is absolutely heard. I want to encourage Kentuckians to hear Breonna's mom's message. And as we come out of this pandemic, one thing I've talked about is let's make sure we fight and we finally achieve equal access and equality in health care. Because we have not just seen Breonna's death, but we have seen disproportionate deaths of so many, and each other individual has a name and a family too. And it shouldn't take a once in every 100-year pandemic for us to do something about it. It shouldn't take the raw pain and what we are seeing out there in society for us to do something about what absolutely and obviously exists. We've talked each and every night about how absolutely everyone matters in this pandemic. Everybody's actions matter in this pandemic. How about we believe that everybody truly matters? How about we believe that, every child born into this world deserves real opportunity, and every family and individual deserves to be able to see a doctor when they're sick? And how about we do more than believe that? We actually try to do something about it. So, I know that tensions are high, but I want people to know that they are being heard, and I know it's not fast enough, and I know it's not satisfying. But let's make sure that we're also protecting our fellow human being out there, and that we're doing things safely, both in this virus and for each other. And let me finally say that while I'm trying to provide the right words, I don't claim to understand the depths of pain and frustration that I know that so many people feel. I can't. But what I can commit to do is to listen and to do my best to tell you that, and to mean it, that I want to move this world in a better place. And that's my commitment to continue to do. All right, there's no easy transition from that to the other things we're going to talk about tonight. But let me first say that our next one of these, our next press conference, will be on Monday. And we're going to go Monday through Thursday next week. And we're going to do them at 4 p.m., a change that's been requested by a number. And we'll hopefully ensure that we can still communicate with as many people who ultimately want to tune in and watch. I'm going to ask Eric Freelander to come up and give an update on our senior care. And I'm going to take a minute. And then I'll come back and talk about our numbers, the MCO contracts, and our other news of tonight. Thanks.
Good evening. The governor asked me to talk a little bit about long-term care and what we've been doing and what I think is a very rapid ramp up in our testing capacity. As I've said to you all before, we took very early action. We limited in-person visitation in our long-term care and on our congregate care settings. This was important. It was vital. This is the way that we know the virus can come into facilities. And we know that through some of our contact tracing. That actually has happened. So we need to make sure that we don't, and we needed to make sure that that was not going to be a vector for us. We made changes in some of our reimbursement, and we asked a group of experts to come and help us with guidance for long-term care. And that group has been meeting a couple of days a week. They've been very dedicated. And these are medical directors, these are medical ethicists, these are folks from the University of Louisville and University of Kentucky. These are people with the long-term care ombudsman and AARP. So it's a good group of folks to examine and advise the cabinet. And they have. And they've given us very good advice. And that advice has changed a couple of times as we've learned. And we've learned new things this entire time. The governor said the other day, we have not been perfect. Obviously, you can see that in the numbers. But we've been very aggressive, and we've acted very early. And in the early days, we didn't have enough PPE, and we didn't have enough testing, and today we do. It's a story of how we have ramped up and come together as an entire community. Groups that didn't necessarily trust each other, hospitals, local health departments, long-term care facilities. We would be on the phone and we'd work those relationships out, and now they are working together seamlessly. Our infection control group with public health, our friends at Norton Healthcare, and the local health departments have been responding quickly and aggressively when we've identified positive patients and facilities that need our help. We've done several emergency transfers from nursing facilities and assisted living facilities. We test personal care homes as well. And we believe a national study has shown that probably between 50 and 60,000 residents and staff need to be tested. So in just a short period of time, we have tested, as of today, about 15,000 residents and staff. We expect to test another 5,000 to 10,000 next week. We expect to have fully tested over 100 facilities by the end of next week. We are being very aggressive and very deliberate. When we do these tests, as we saw with Nazareth at Clifton, you need to have a plan and you need to be prepared to take action, and we were. And we'll continue to do that. This is an aggressive disease in long-term care. These are our most vulnerable citizens. These are our moms and our dads. I think I talked to you last time about a woman at Trayton Oak Towers. They actually ran a story about the love of her life. Richard and Cecile Spaulding was in the Courier this week. It's a beautiful story and a tremendous loss for the community. So we'll continue to respond, we'll continue to learn, we'll continue to ramp up our response. We are testing over 1,000, sometimes 2,000 folks a day, and we'll do that until we get every last person tested, and that's our commitment.
All right, so today's report is up a fair amount in cases, and we'll have to wait to see the next couple days to see whether it is just labs getting caught up from the weekend or whether it is in and of itself significant and something we'll see moving forward. So today we're announcing 283 new positive cases of the coronavirus. And why I said we've got to wait to see what that means is still, if you look at the last 4 days on an average, it'd be 158. And so if these are truly cases coming in over that period of time, that is still a decline, and a significant decline from even 2 weeks ago. We'll have to see as we move into tomorrow and ultimately into next week. You know, previously what we'd seen is cases would increase on a Wednesday or a Thursday. What we've got to see here is that Monday that the labs weren't open, pushing that into Friday. So I don't want to suggest that it means something at this point either way. What we've got to do is wait and see, and we will respond accordingly. But we will respond making sure that we're doing it with the knowledge of what it does or does not at this point mean. After we do our daily audits, our total number of cases from the very beginning to date, and remember this includes a lot of people who have recovered, is 9,464. 161 of those are probable, the others are lab confirmed. Of those 3,231 people, we have reports of having recovered. It's out of a total number of tested of 227,944. It's up about 6,000 from yesterday. Again, that's a real positive increase in testing we're seeing. Total number ever hospitalized, 2,266. Currently, 499. Ever in the ICU, 940. Currently, 81. And again, that recovery number, because it's my favorite number, 3,231. New cases by county, 62 in Jefferson, 41 in Fayette. A number of this is from the federal prison. Again, we have very little control on what happens there and how the testing occurs. It is a significant amount of tests in Fayette County. I've done everything I can to push and to pressure and to argue and to fight to get all the individuals out there, especially the employees, tested. Warren County, 31, Gallatin, 18, Kenton, 17, Shelby, 16, Boone, 12, Logan, 11, Campbell, 10, 7 in Allen and in Franklin, 4 in Davis and in Nelson, 3 in Graves, Henderson, Madison, and Oldham, and 2 in Anderson, Bullitt, Callaway, Grant, Hardin, Metcalf, and Simpson, and 1 in Adair, Barron, Bath, Butler, Carroll, Casey, Christian, Clark, Crittenden, Fulton, Jessamine, Marshall, Pike, Woodford, and 3 are unconfirmed. Today we're also announcing that we've lost an additional 9 Kentuckians, bringing our total death count to 418. 1 probable, the rest lab confirmed. These are 9 families that again need us to light our homes and our places of business, our places of worship, everywhere up green for compassion. You know, right now with all the events of the last couple days, compassion is something that we ought to have on full display, even when it's hard. Those we've lost tonight include a 74-year-old man from Butler, a 51-year-old man from Butler, a 90-year-old woman from Butler, a 68-year-old man from Gallatin, an 83-year-old woman from Butler, a 70-year-old woman from Butler, an 88-year-old man from Butler, a 55-year-old man from Oldham, and a 64-year-old man from Gallatin. Race and ethnic breakdown of our cases, which we do each and every day. Of overall cases, 85% non-Hispanic, 15% Hispanic. On race, 74.15% white, 14.68% Black or African American, 5.4% Asian, 5.53% multiracial. And then on the deaths, it's about 97% non-Hispanic and 3% Hispanic on ethnicity. And then on race, 78.46% white, 17.82% Black or African American, 1.86% Asian, 1.86% multiracial. And like I said earlier, it's not right. It's not right. Let's put up the long-term care facility numbers. So a lot of what we see today, and I believe what we see in those numbers, but we need to get more data on our numbers from today, is our significant testing in our long-term care facilities. If we test everybody, if we tested 15,000, is that the number? Then we're going to find more positives. We're going to find a lot more asymptomatic folks, but we still want to know to make sure it doesn't continue to spread. So today we have 77 additional residents, 27 additional staff that have tested positive, and we've been able to delineate that there have been 15 additional resident deaths, though obviously those are looking back in time. It does take us some time while we get the reports in. We do have to then go back and figure out if they are in long-term care facilities. We know by now that the steps we're taking are important, that they are critical based on the numbers that we see. Again, I don't want to jump to a conclusion about today's numbers. We got to admit that they are higher, but we also have to know that any average that we've seen over the last 4 or even more days is on a decline and is lower. So let's wait. Let's see tomorrow. Let's look at where we go into next week, and we can make a logical conclusion about what is or isn't going on. All right, a couple of additional announcements, and this is a healthcare announcement, and it's one that, while it's not directly related to COVID, it's really important that people have the care that they need. So Kentucky's Medicaid program is administered by what we call MCOs, Managed Care Organizations. These are companies that come in and provide this health care through Medicaid to over 1 million, and right now, much more than 1 million Kentuckians across the state. And without expanded Medicaid, which increased that number, I don't know where we'd be in fighting this virus. It's ensured that more people have health care, and while we have more that we need to do, I think it's been a godsend, and thank goodness that we have it in place. So when I came into office, I think it was a week or even less before, we saw the previous administration had scored and released awards of contracts to manage. These are multi-billion-dollar contracts, some of the largest contracts in the state. There was a concern based on the timing and based on the perception, and therefore we put it out to bid again. This is a process where a group of people score it based on determined criteria. It is done outside of me. I wasn't a part of it whatsoever. It is done objectively, and it's done under the law. Under the law in these contracts, you can't give things to your favorites. You can't just pick out different groups for different reasons. It has to be done pursuant to this procurement law. And so today we announced 5 companies that will be awarded contracts to help with managed care. They are Aetna, Humana, and let me skip to WellCare. The 3 of those have been providing Medicaid services as MCOs the last several years. But there are 2 new MCO Providers, Molina Healthcare, and United Healthcare. But what this also means, because this happens, is that there are several that did not score in these top 5 and therefore have not been awarded contracts. They include Anthem, who does our state employee health program and I think does a really good job. It also includes Passport, which is a company that has been a really important part of Kentucky, and it's been Kentucky-based. But under our procurement law, this company, Passport, which I believe placed 7th of 7, not just in this round, but in the round before, you simply can't award a contract without violating the law to that company, and therefore it is not receiving one. I do want to say that it's provided great service. It's been an important community member in Kentucky. I do believe that some of our new companies here are going to provide real and special opportunity, and real and special opportunity including to the Louisville community and the West End of Louisville. I saw a release right as I walked up that one of these companies is committed to creating almost 1,100 jobs in West Louisville in a headquarters. I think that has the opportunity to not only be of huge impact, of being transformational, but also, given the time that we have leading up to it, a lot of that workforce could come from that community with job training that could be done in that community by anchors in that community. So while this does appear to be at this moment a goodbye to a company that we have known for a long time, it may also be a chance to say hello to real opportunities, also including some different talks that I know Humana has been in to make some very significant investments to try to move all of our communities forward. Finally, and then we'll get to questions because it's Friday and we should let people get off early. A quick announcement on driver's licenses, and I don't think that I ended. There we go. Today we're announcing an official order temporarily authorizing circuit court clerks to process expired driving credential renewals and replacement requests remotely, meaning you can get your driver's license renewed without going in. And to me, that sounds wonderful. Cardholders whose operator's license, permit, or identification card was lost or expired between March 1st and June 30th, 2020 may apply with their local circuit clerk to receive a new card in the mail. The order allows remote application process to remain through July 31st, 2020. Applicants requesting a card renewal must not request any testing. More information will come from AOC on their website soon. Until then, the March emergency order remains in effect that extends the validity of cards by 90 days if the printed expiration date is March 18th, 2020 or later. So this means that people won't have to go in, can get their driver's license renewed. This is something that the administrative office of the courts, the circuit clerks, and the governor's office all worked on. And hey, I hope in the future, unless there's some new test that's required or some update, that we can all get our driver's license renewed through the mail or other remote means. We might have to get our pictures updated from time to time, but I think that there are things coming out of COVID-19 that we realize that we don't have to do in person, and in fact could be a lot easier to do remotely. All right, with that, let's move to questions. I believe we have 1, 2, 3, 4. We have 5 of our reporters that are here today, as well as a University of Kentucky student that is observing. Welcome, Dylan. So we have Phil, Lawrence, Mike, Joe, and at some point we'll turn the camera around because you all have probably become very familiar with folks. So let's start with Joe 1, and then we'll go to Joe 2.
Regarding the protests in Louisville, have there been any discussions about activating the National Guard to kind of keep the peace out there?
This is about protests in Louisville. Has there been an official request to activate the National Guard? At this point, there has not, but the Kentucky State Police will be offering some significant assistance tonight. And that's just to make sure that we can keep peace, that people can be heard who need to be heard, but that we don't let a rogue element turn a protest calling for justice into something violent. Some parts of the country are reporting a spike in drug overdose cases during the pandemic. Are we experiencing that same spike in Kentucky? I believe that answer is yes. I don't have the numbers in front of me, but any time that a virus like this makes it more difficult to connect, that's going to be real hard on addiction. And this is a mean virus. It is mean, and it attacks all of us in ways that make it harder to get through. I mean, our connections with each other are how we deal with so much, from addiction to adversity to depression. You pick. And so, yeah, we're going to see that this virus didn't just have direct impacts, but its harm is even more. It doesn't mean we didn't have to do what we had to do. We absolutely did. Had we not, as we looked at the chart the other day, we would have been having almost 3 weeks ago 16,000 cases a week. We've had 9,000 cases overall. But it's taking a heavy toll. Joe.
Regarding the breach in the unemployment system that you referenced yesterday, the Attorney General and Auditor put out a press release today saying that the delay in the disclosure suggests carelessness and a disregard for the importance of protecting personal and financial information of our citizens. Who bears ultimate responsibility for that delay happening, and did anyone face any discipline or over the delay?
So the question is that the auditor and the attorney general apparently put out a joint press release on the data breach and the delay in its report. I hope that they got and received information from us before they came to a conclusion and put that out. Otherwise, it wouldn't necessarily be based on facts. But I stood here yesterday and said the reasons why. And the reasons were that the Workforce and Education Cabinet did not believe under the law it qualified as a breach. That was their belief, and that was their legal opinion. When we found out about it, we disagreed. And ultimately, I made the call that we were going to err on the side of making sure that we provided direct and full notice. I've already authorized an inspector general from a separate cabinet to come in and look at it, because I'm not trying to score political points. I'm trying to do the right thing. And I think that's important. And as Attorney General for the last 4 years, we looked at each and every data breach that came out. And this one, it doesn't appear that anybody, at least thus far, has been financially harmed by it. But that doesn't mean that we don't need to be transparent, that we don't need to disclose things and to do it timely. So I'm going to be a governor that when I disagree on something that's gone on inside even our own government, I'm going to speak up about it. And sometimes it's going to be based on legitimate disagreement on what something means under the law and whether something qualifies as a data breach. I'm not happy about it. As you can see, I'm taking some major steps on it. Mike.
Governor, do to address these racial inequities that are embedded in many of our institutions? And do you see this as a moment of reckoning in the country?
The question is, what can I do as governor to address some of these racial inequities, and do I see it as a moment of reckoning in the country? On that second question, given who I am and that I can't feel the years or the intergenerational pain caused by everything from slavery to Jim Crow, it's hard for me to feel and to answer that second part of the question. But let me answer the first about being governor. I've taken steps that I hope put us on a better path, or at least small bricks to help build a better world. They go from building what I believe is one of the most diverse cabinets that we've seen in Kentucky, where our top 2 appointed officials for the first time in our history are African American, to restoring voting rights, which disproportionately were taken away from individuals who were African American, to fighting against a rollback of Medicaid, rescinding that Medicaid waiver, which would have disproportionately impacted African Americans. But we need to do more going forward. I don't think there's any question about that. I want to make sure that I put steps in place. It may be a task force, it may be others. I'm trying to be thoughtful about it, especially with what's going on right now, about how we address the inequity in healthcare. Because I believe that while a lot is going on right now, and a large part of it is in our justice system, this virus has laid bare inequalities in our system. And on the healthcare side, I think that there ought to be a lot that I can and should do about it. But it doesn't mean that I know all the problems that are out there, having not suffered from them myself. So my goal is both to continue to listen, and today I've reached out to leaders in the African American community to talk about this, also to talk about the MCO awards, knowing that they will have an impact, and I'm going to continue to do that. It's unacceptable that we still are where we are. And while I can't feel the frustration on the same level, that doesn't mean that I can't be committed to listening and doing something about it. All right, Karen Czar is not with us today. Are we learning any new information about the inflammatory syndrome in children? We have questions from parents as to how long they should monitor their children. So Dr. Stack's not here tonight, but the good news is we don't have any new children, that every child is now home from the hospital, and I will tell you there was at least one that was in really bad shape, and that's a really positive sign. That thus far it looks like it can take place at least 8 weeks after the child contracted COVID, and they're theorizing that it may be the body's overreaction to the next time that they encounter this virus, but there's still a lot we don't know. Given how many kids we had in such a short period of time, I am very thankful that we haven't seen more than we have seen thus far, but we are watching it very closely. Phil.
Later on in the summer, are you expecting to get some guidance as far as some of the larger outdoor events?
Yes.
Such as like festivals, picnics? I understand that even in Western Kentucky, Fancy Farmers, they've got a plan to possibly even have that. What's your guidance for things like that?
The question is, as we move later into the summer, bigger festivals and events, what type of guidance we'll have on it. Well, one step will happen when we reach the 50 or less with social distancing. So that will certainly allow weddings with 50 or less. They should be outdoors. Outdoor events where they can keep things to 50 or less. But we are also going to have to see plans and really look at when we get larger than that. With an active, aggressive virus out there, 50 people right now, I hope everybody out there would look around, see that, and think, we got to make sure that if we have that many people together that we are doing it right and we are doing it safely. I'm going to continue to have 2 goals. And every decision we make, every time somebody's upset something's not opening or opening up fast enough, here are my goals. Number 1, reopening our economy and getting it back online and humming and not having to pause it. And number 2, getting our kids back in school. And so if there are things that you want to happen faster, I would ask that you consider this. Is it worth either of those things not happening or causing delay in them? We don't want to keep something closed that can be open. That's not something I want to do as governor. I ran on more opportunity and having our kids get an even better education thanks to wonderful educators. This has been hard, and we're going to continue to do the best we can moving forward, making the best public health and economic decisions we can. Lawrence.
What assistance will state police be providing to LMPD and how many officers
The question is, what type of assistance will state police be offering? We're offering resources in terms of troopers, and I don't have that full number. I believe that it is over 50, but it may be north of that. So please know that's an approximation. and some equipment. It's wanting to make sure that people are safe, and that's their goal. That's their entire goal. All right, Joe.
What makes, these rounds of contracts different from the ones that Bevan issued that you rescinded towards the end of his term? And do you still feel justified pulling those contracts, knowing that those are the same companies that ended up getting them?
Question is on the MCOs and what was different in this round than when the Bevan administration scored them, and was it justified with us pulling their award? First, we will have the documents up online today. Almost all of the documents related to the award. That gives everybody an opportunity right at the start to look at them, to make up your own mind. It's an attempt to be, I think, as transparent as we've ever been, but an attempt to just be transparent about the award. That'll be the score sheets. The one thing we won't have up all at the beginning is everybody's proposal, which is just a ton of pages that we're still trying to get scanned in. I think the fact that two different administrations and two different groups of scorers ultimately came to the same conclusions, though the top five that were awarded, some of those switched places within those five, I think it should give people confidence in it. And when I came into office and talked about this, I didn't accuse the Bevan administration of wrongdoing. I just talked about both the perception of how late it was awarded with some of his comments related to Passport. But one thing I was very careful about is to not suggest that the scoring was done incorrectly, but given everything that was out there, we wanted people to have confidence in it. And if you look at the decision, it does have a major impact on what has been a strong Kentucky company. But I hope that people see now with the multiple rounds that it's truly based on objective criteria and the scoring therein. Now I expect the companies that weren't successful won't be happy about it. These are big contracts and they have a big impact, and I expect they'll be vocal, and that's certainly their right. But I think the right thing was done, and I think that looking back and seeing both should give Kentuckians comfort that this is done objectively. Joe.
Been more thoughts about when the Louisville Zoo might open? Have there been discussions with the administration on that?
There have been discussions on the Louisville Zoo with the Louisville Health Department that they believed were very positive. That information has been coming up to our Division of Public Health. I know they've had those conversations. I know that I believe that they have even settled on a plan that we believe would be safe. What I don't have is the date. We will. I don't think we have announced a date, and that could be on a number of different ends. It could be that the zoo needs to do what they need to do to get ready. But what the zoo can do, and what Kentucky Kingdom can do, and should be done right, is that you can enforce the number of people that get in. Obviously, it's outside too, and you can also enforce the size of any individual group. And you got a significant number of employees that are there to continue to monitor that. Mike.
White House officially severing ties today with the World Health Organization.
So my thoughts on the White House severing ties with the World Health Organization. I'll admit we've been pretty busy today, and I hadn't seen that news. I can understand if we believe that there are failures in the World Health Organization, but my understanding is that they're conducting significant and serious research in everything from this inflammatory disease that is impacting kids to other research that can come from all different countries to give us a better idea of this disease. I hope that research can continue. I hope that if we are, as a country, severing those ties, that we can somehow continue to support that research. Right now, we need more knowledge, not less. Not knowing when a vaccine is going to come, though we hope it comes soon. And since I'm saying this, let me credit the White House, because you should do that when they're doing something right, with how much pressure and momentum that they have put behind a vaccine. And that's not just recently. I saw some criticism of how long it took the president to appoint someone who was going to be his vaccine guy. They've been pushing, and they've been talking to us about how hard they've been pushing for a long time. And that's I think one of the most important actions they've taken. If it works out in a time period that's faster than we've ever seen, then that's a real credit. But I do worry potentially about the impact that this could have on research. Now, it may be that they've already addressed it. I certainly hope that they will. Phil?
Contactors, property owners concerned about the tenants that obviously they can't pay the rent because they don't have a job. Yet they have bills to pay too, so any kind of advice for them on what they can do to help the situation and also pay for
Yeah.
this.
It's a tough time, especially with rent, and that's both on tenants and on landlords. I mean, we hear a lot of stories about landlords who are trying to kick people out in the middle of an epidemic, and that's a small percentage, but it's one that you got to address, and it's one that rightfully gets attention. But you got a lot of really good landlords out there too that are looking at what do we do? I mean, what do we do about rents that were ultimately owed? And that's going to be a hard issue coming out of it. One thing that we know is the Team Kentucky Fund, and we can have an update on this on Monday, is helping people right now with their rent. It's helping people right now with their utilities. We're making sure through the Community Action Council of Kentucky and others that those dollars are going out to help people, and that's one way that we can help, at least in a small way. Now, folks ought to know that as we come out of this, and we're going to need to get everybody back to work, we're going to need a long-term solution for that, which is going to take, agreement and compromise between both landlords and tenants. We talk about getting through it together. That's included in that situation too. Lawrence.
You alluded to this earlier, but there are concerns, I'm sure, about the passport headquarters project that would have created a lot of jobs and economic activity. What promises have been made, and what's going to happen with that project?
The question is on the passport headquarters. My understanding from reading different releases and from different stories both recently and before is that one of the successful awardees has committed to finishing that project and committed to creating a headquarters that they hope could be there. They would have to acquire the property. I mean, there are some issues there, but committing to building a headquarters in the West End that could employ up to 1,100 people. And that'd be really significant. 1,100 new jobs created at a time when we're restarting our economy in an area that hasn't seen enough new jobs with what we hope is a company that will be incredibly stable. Can be a really amazing opportunity. I actually do believe that while this is hard, saying goodbye to Passport, that we are going to see investments from multiple of the award winners that could be really transformational. I believe that while we've seen a lot of hard news the last 2 days, that we could potentially see coming out of this the types of investments that we haven't seen in decades. Now, those have been promised before, those have been discussed before, but I see a real possibility. And I know that there are a lot of leaders in the community that are excited about those possibilities. I'll do one more quick round. The company that put out the press release was Molina. But I don't believe that they are the only company that is planning significant investment. And it makes sense, right? Especially from a Louisville-based or one that's going to be Louisville-based, and obviously these are based all around. When you're looking at improving health outcomes, improving job opportunities is an important part of that. And if you have an opportunity in creating the infrastructure of especially a new system or in moving it around, creating more opportunities for good jobs and healthy lifestyles is something that I believe is a good business model for it too.
Do you anticipate that presence being there tonight only, over the weekend, indefinitely? How long do you anticipate that?
The question is with the Kentucky State Police being available to assist LMPD tonight, do we see it continuing? If LMPD needs that help, if the city of Louisville for keeping things peaceful needs that help, they'll be there. And we see different things popping up. We hear different rumors of different outside groups coming in. I want people to be heard. And I want them to be able to be heard without violence and without people hijacking what is a peaceful but can and potentially should be a very demonstrative, right? Protest or rally, or you pick, from becoming something that's not productive. Joe.
Community centers can open up, like the Americana Center in Louisville, will serve the immigrant community and provide services. Is there any discussion on when those will be able to
We need to figure out, one of these challenges is classifying, right? Some types of businesses or community groups that don't neatly fall into a forward-facing business or a retail or the other. So we will need to have that direct conversation with them. Once we hit the 50 or less, which is certainly in June, any time that people can have the social distancing and serve a group that is that or smaller, they're going to be able to do it. That's going to make things a lot easier in that instance. But the Americana Center is an incredibly important facility. They certainly could start serving 10 or less with social distancing now. But let us communicate with them so we understand exactly where they would fall. But it's admittedly a challenge of reopening, in that you have a couple different classifications that hit about 98% of businesses, which can be open now. But then you still have a few that are very different but very important. So we'll jump on that. Mike.
Protest in the works planned for tomorrow. I know Frank Simon is one of the people coming in charge. What are the plans security-wise, and if they're not in cars, will they be allowed?
So there is apparently another protest tomorrow at the Capitol by an individual who was at last Sunday's events. That individual, do you have that? Went on Facebook and apparently said, hanging a governor in effigy, or apparently storming the mansion, was not a big deal, and I think his words were, as long as they didn't pull me out and hang me actually, that things were fine. This is not okay. These are the types of extremist groups that some of our elected officials have been catering to, that have been listening to. This is somebody whose support has actually been sought by different people out there now. I don't know that they would have expected this. This is much further. But our politics cannot be driven by groups that want to inspire hate or fear, or stand in front of groups that they know are likely to do the wrong things and encourage them or whip them up. This is the absolute wrong thing. But despite their attempts to create fear or terror, I'm not going to be afraid. Now, I believe that one of the 3%ers stood outside my office, not too far from my window today. I knew probably what he was trying to do. To be close to where my family lives, to be close to where I work. The fact that we have somehow emboldened those that would do these things is wrong, and it ought to stop now. But to them, I'm not going to stop doing the right things and protecting people. And to anybody online who's trying to talk at any given time about where my kids are, you cannot deflect from the attempts to create terror and hate. And I would hope that you thought your kids were off limits too. All right, Phil.
Something in there that said that kids are not supposed to travel with out-of-state teams or something to that effect. There's some kind of ruling about that.
So we start with our youth sports plan and trying not to spread the contacts outside of the community that the kids are in. Again, the more that we do that, the more that the virus spreads. And so we're trying to start with a youth sports plan that doesn't take contacts from other states or from broad other communities. And so in trying to do this safely, I know a lot of people are talking about travel baseball. What I would really encourage is for your travel ball teams, if you can, or you will, or you're willing to, sign up for a Little League or a Babe Ruth, or do it within your city. You know, a lot of cities or communities that are close have a lot of these teams, and listen, I've been at a lot of those games. I believe that people can do this, they can do it safely, and that they can still have a lot of games that might not look the same as it did before. But remember, if we have these tournaments right now where you bring in 100 teams or 40 teams from all over the state or all over the country, that's a lot when we're trying to reopen our economy when this virus is out there. So again, my question to those that would want to have one of those big tournaments is it worth risking the reopening of our economy and getting people back to work? And is it worth risking getting our kids back to school? So what we've tried to do is find a reasonable way for youth sports to start without creating an unmanageable risk. All right, Lawrence, last one.
I'll end on this. With more demonstrations planned tonight, concerns about violence, what's your message to the people of Louisville as they look at this and are concerned about it?
The question is, what's my message to the people of Louisville as we see more potential protests tonight? I can't pretend to understand the level of frustration, fatigue that people must feel with hundreds of years of inequality, things being more difficult than they should, maybe being looked at, judged, and treated differently, of seeing a virus right now that is taking more lives because of it, because action wasn't taken soon enough, to see videos of someone putting their knee on someone else's throat while they cry out for help and nobody does anything about it. I can't pretend to know how that feels, but I can commit to listen, being the governor of the Commonwealth of this state, and I can commit to do everything that I can in our system to help. I hope you understand, and everybody understands, that we're laying bare the problems in our society, and we need to recognize them, but we also have to commit to do something about them and understand that commitments have been made before and haven't been followed through. But now ought to be the time, and this ought to be the place. And I hope that provides some level of encouragement, though I know it's raw and it's hard right now. But I hope most of all that it tells people that and I hope everybody else is listening and hearing, and that we don't, and that violence isn't necessary to make that point. I also believe that there are groups out there that want to create a violent situation, to cause harm to the community that is protesting, and to those trying to keep the peace, that understand that there are some forces out there that hope that they can create a clash because that's what they want, and then they're going to get out of the way because they want harm to both. Let's not give them that. Let's not let groups like these 3%ers, like these extremists, turn people against each other and create violence. Let's not let that happen. And I'll admit to you, Lawrence, I don't have the right answer, and I probably don't have the right words. But I'm the governor of this state when this is happening. I've been a Louisville resident up until I moved my family for 15 years. It tears at the fabric of who I am to see this happening, but I hope that we can respond the right way. I hope that we can be better. And I really hope that we can listen and then we can do something about it. All right, so I hope we have a safe weekend. I hope we have a weekend all around the state where we do the right things to defeat COVID-19. We will see you on Monday at 4 p.m. And of all these things, we're going to get through this together. But let's make sure that everybody believes that we are together. And that requires that people be heard and that we admit that when we have real problems in society and we haven't done something about them for far too long, that people can be rightfully frustrated and tired. And now's got to be the time when we start to fix it. Thank you all very much.